What is harm reduction in drug abuse? Have you ever wondered how society can better support individuals who struggle with drug use? Let's talk about harm reduction in drug abuse. This approach focuses on minimizing the negative health, social, and legal consequences of drug use. Instead of insisting on complete abstinence, it recognizes that some people may continue to use substances despite the risks involved. The main goal is to reduce harm and improve the well-being of those who use drugs through practical strategies and compassionate care. One key principle of harm reduction is the acceptance of drug use as part of life. It acknowledges that addiction exists and that individuals who use drugs deserve respect and support. This principle encourages collaboration to reduce the adverse effects of drug use in a non-judgmental way. Another important aspect is the recognition of safer ways to use drugs. Harm reduction supports the idea that there are safer practices, such as using smaller amounts or using drugs in supervised settings. These strategies can help avoid overdose and infections. It values incremental improvements, even if drug use continues. Harm reduction also emphasizes that there is no one-size-fits-all treatment. Quitting drugs abruptly can be unsafe due to withdrawal symptoms. This approach supports a range of options, including managed use and abstinence, meeting individuals where they are in their recovery journey. Respect for the rights and autonomy of people who use drugs is another essential principle. Individuals are entitled to dignity, privacy, and access to health services without discrimination. Harm reduction promotes involving drug users in designing programs that affect them, ensuring their voices are heard. Additionally, harm reduction is committed to evidence-based practices. Strategies are based on scientific evidence that shows effectiveness in reducing harms like overdose deaths and the transmission of infectious diseases. Examples include needle exchange programs, supervised consumption sites, and distributing naloxone to reverse overdoses. Reducing stigma and social barriers is also a significant part of harm reduction. It works to eliminate discrimination that prevents people from seeking help. This approach promotes respectful language and policies that avoid labeling drugs or users, which can create barriers to care. In practical terms, harm reduction can include providing clean syringes to prevent disease spread, offering supervised consumption facilities to reduce overdose risk, and educating individuals on safer drug use practices. It also supports access to treatment options without coercion and engages communities to support those who use drugs. From the perspective of substance abuse and addictions, harm reduction is a compassionate and pragmatic approach. It prioritizes health and human rights, complementing traditional addiction treatment. By acknowledging that recovery is a process, harm reduction helps bridge gaps between drug users and healthcare services, fostering safer environments and reducing the overall impact of drug abuse.